Hello, my name is Ian Rowe, resident fellow at American Enterprise Institute, and for the last decade, I have run a network of public charter schools in the heart of the South Bronx and the Lower East Side of Manhattan. So I'm very familiar with the challenges that we are going to be discussing today on this panel named, Should We Be Sending K-12 Students Back to School in Person? This is an incredibly important question. Like many of you, when running schools last March, I was thrust into a situation where we suddenly had to be distance learning more than 2,000 kids. And over the course of the last few months, districts across the country have been grappling with the question of online instruction, in person, what are the health concerns? And so today we've gathered incredible information that can help districts make decisions on the best way to approach their students within their particular localities. We have two panelists in the first section of our conversation. Nat Malkus, who's a colleague at American Enterprise Institute. Nat Malkus has spent most of his time this March and since then tracking how the nation's schools have responded to the COVID-19 pandemic. Nat will give a presentation to sort of lay the groundwork. And then we also will be joined by Emily Oster, who's a professor of economics at Brown University, where she focuses on health economics and statistical methods. Her analyses on school reopening data have made her a go-to authority on schooling in COVID-19. After Matt and Emily give their presentations, we'll then be joined by three respondents, Sarah Cohodes, Marla Ucelli-Kashyap, and Susan Enfield. I'll give a longer intro when they join us. But we're really excited to get into these questions. Now, we know that coming at the end of this discussion, we won't have a consensus answer because there isn't a silver bullet solution, but it is important for us to know what is the latest information. It seems every day there's new data on infections, whether schools are super spreaders or not, and how can folks make good decisions given the current context. So with that, I'm very pleased to introduce my colleague, Nat Malkus from the American Enterprise Institute. Nat, will you join us?
Thanks, Ian. And thanks everybody for joining today. I'll share my screen here so that we can get this started. And yeah, so I'll begin today actually by looking back at spring remote learning. Partly because the indications are that it was maybe even more problematic than we might have appreciated. Both in terms of quality and quantity, leaving to a big hole for students to dig themselves out of and animating sort of the question of whether they should be back. This first bit will draw on a new report, Too Little Too Late, released last week, which used 6 waves of data that we at AEI Education collected, 6 waves between late March and mid-May for our COVID-19 education response longitudinal survey. And then I'll actually look at some data about reopening with the 7th wave of the same districts collected this fall to look not only at how schools have reopened this fall, but also how reopening statuses have shifted already this early in the year by October 1st. And finally, present some good news about remote learning this fall. So let's jump in here. This is an example of some of the information that we gathered in the spring over time, again, 6 time points. And what you're looking at here is just instructional platforms offered by school districts. These are in terms of percentages of schools. So the blue line you see are the percentages of schools that were offering instructional packets over time. Those are static packets that students would independently work on. The orange line is asynchronous platforms that were offered, and that's Google Classroom, think Google Classroom. And then the gray line at the bottom is synchronous platforms that were offered. That's the percentage of schools offering things like Zoom or Google Meets and so forth. Now, I didn't put a bunch of tables on here, but I do want to point out very early that there are a lot of districts in differences between districts on these and many of the other platforms that that we gathered with Searles. And I don't want your eyes to glaze over just yet in the presentation, so I'm going to keep you from all those tables. But in broad strokes, we find that districts serving more disadvantaged students tended to have less sophisticated learning platforms. They were more often dependent on sort of instructional packets, or at least partly dependent on them. They had fewer internet resources. There's a number of aspects. And so that's true for high poverty schools and for low achieving schools, among other indicators. The list is long. I'll refer you to the report. But that's just very troubling, because we've been struggling against achievement gaps for quite some time, and this is a body blow to those. You know, the other thing that I'll point out to here is a lot of the attention on what districts offered last year was sort of focused on these end numbers, right? So you could sort of see this as half glass full, right? 44% of districts ended up offering synchronous platforms to students. Okay, but I'm not actually convinced that the end goal is what we should really be concerned about. I'm more concerned about, during the whole closure period, how much of the time did students have access to different programs and resorts. And so to do that, we really need to be more concerned with sort of this area under the curve, and thinking about it in terms of access over time. And when we compare those things, the glass half full is sort of hard to see. So these are those same percentages we saw at the end of the year. And then the orange bars are sort of the calculations with the longitudinal data of how much of the full closure period, from the day schools closed to the last scheduled day of the year, students had access to these platforms. And this is available for a number of the measures. But again, if you see the possibility of a half glass full at 44% of schools offering synchronous platforms, they were available for about 32% of the full closure period. That's harder to see half full. And again, we have the division between poorer districts, where that figure was closer to 25%. I'm afraid that it actually gets beyond just sort of these quality problems. There's also a quantity problem. And so when we look at lost instructional time, what you're looking about here is the number of days, and this is divided across districts by free and reduced price lunch or poverty indicators. This is the number of days that were canceled, and it's about 8.5. It didn't vary measurably across districts. And this is sort of the time period between when districts closed down and then they could reopen and offer some sort of remote instruction. And this is substantial, you know, it's 8 days. That's a week and a half, more than a week and a half of instruction. But more troubling is that there's more lost instructional time from student non-participation. So you can see sort of how I came up with these estimates in the report. It's sort of my best take on them. But there's two things to note. Number one, on average across students, we lost more days to non-participation than to actually the days that schools were closed. And number two, there's a good bit of variance by poverty, where there's more lost days in higher poverty schools in higher poverty districts. So to put this in context, that 20.9 days is part of this closure period, and that's right at 40% of the time period after closures and when the original end of the year would have ended if it were not for the pandemic. So these are, you know, distressing, and they animate the question about whether we should have students coming back in schools, which most people will think is an efficient or more efficient way than remote instruction. So where are we in the fall? These are the data that we have on reopening. These were gathered for the first week that schools started. So it was sort of a staggered data collection. And we have about 41% offered an in-person option, 41% of schools. 25% had either a B day hybrid option, or either some grades in person and others remote, and about a third of schools remote only. And the bars below just point to some of the variations we see across districts. I checked every one of the indicators of the activities and platforms that were offered in the spring, and the main one that showed any prediction to or differences for reopening in the spring was whether there was technology, and this is particularly internet help that was offered in the spring. And you'll notice that If there was more internet available from schools, these were Wi-Fi hotspots or other measures, then much more frequently the schools are going back remote and less likely to be in person. And without help in the spring, obviously should be an indicator of the digital divide struggles that those schools were having. They're much more likely to be in person. You can also see that much higher percentages of of schools in high minority districts, high poverty districts, and traditionally low achieving districts are remote compared to their opposite peers. We didn't just look at these compositional variables, but also some of the sort of community or where they are. You'll see a big gulf between blue states or districts and schools in districts that are located in blue states versus purple and red states. Much more likely in blue states to be remote or hybrid comparatively. Much higher percentages of small districts, schools in small districts are going to be in person relative to schools in larger districts. And again, you see the digital divide there with high broadband access in the county in which the school is and low broadband. Now, I told you that I'd talk briefly about changes since the beginning of school. And it should be noted that this stopped on October 1st, but some of these schools have been open for, 3 or 4 weeks, while others have been open for a full 9 or 10 weeks. So this can vary, but there has been a shift to more in-person instruction based on our sample. There's a shift of about 10% down in fully remote, and that's increased for both the hybrid and in-person option, or shifting to some. And this is also not equal across districts. So these are the same percentages that I showed in the previous one with the blue, purple, and red states at opening. And you can see that there's some shift in our districts in blue states, where a higher percentage of schools is moving from remote to hybrid. Not much at all in our sample in the purple states. And then there's a good bit additional shift for red states with more in-person and fewer, mostly coming at from the category of remote, such that about 2/3 of schools in red states by this estimate are in-person with an in-person option. Let me just take a moment to clarify. That should not mean that 2/3 of students in those states are going in person. It's just that that's the percentage of schools offering that. Sizable percentages across all these schools that are offering in-person options. Sizable percentages of students are choosing to go remote during the pandemic. So that doesn't necessarily transfer. Lastly, and briefly, I noted some of the differences between the spring. Here we have the instructional platforms that districts relied on captured at the end of last spring, where about 6 in 10 districts were primarily using online or wholly using online platforms for instruction. And about 20% had a mix of packets and online platforms. And 20% of districts were mostly relying on packets or wholly relying on them. And as we look at the districts that are remote only this spring, pretty much all of them are relying wholly on online platforms. So that shouldn't be taken as evidence that those remote programs are fantastic, but the relatively low bar that we saw some districts not meeting in the spring with these platforms, while they were in that period of emergency learning, has been overwhelmingly met at this point. So that's all I have. I'll leave it there because I'm very curious to hear from Dr. Emily Oster about her work on transmission rates.
Okay, so thank you. That was super interesting. Yeah, that was great. I'm super excited to be here and talk to you guys a little bit about the stuff that I've been doing around schools and transmission rates. So I thought I would say very briefly who I am, and then what we've been doing, and then I'll just show you some pictures, some sort of play around with our dashboard a little bit, so you can get a sense of what I think we're learning in these early days. So I'm an economist at Brown. I focus, as Ian said, on health and statistical methods. So I'm not an education researcher, but I do a lot of stuff with parents and kids, and I do some writing that's kind of outside of my academic area. And during the pandemic, I've been doing a lot of writing for parents around kids in school and COVID, and trying to help them navigate some of the choices around daycare and camp, and then sort of slowly around school. And as we kind of came into the fall, I realized, along with I think a lot of other people, that that we were sort of opening schools. Some schools were opening, some were not opening. And we had very little idea of what that was going to look like in terms of transmission, which is understandable because we had not done it. Basically all schools in the U.S. were closed in the spring. But more than we didn't have a plan to learn about that, and there was not some like systematic, organized plan to collect data over time. And I think that has sort of continued to be true. So, so when we look at the kinds of data that are coming out of, say, individual states about COVID in schools, we're seeing a lot of not a lot. Some cases, states have dashboards where they report cases, or they report cases by schools, and that's super helpful, and that's really really good to have. But what that data lacks, what that sort of reporting lacks, is context. So we don't know, we report cases in schools. We don't know, is the school fully in person? Is it, fully hybrid? How many kids are there? There are 2 cases. Is that a school of 10? Is that a school of 1,000? And from the standpoint of sort of decision-making and thinking about risk, it's actually really different if there are 2 cases in a school of 10 than 2 cases in a school of 1,000, particularly if that's systematically true in sort of one of those two directions. And the second thing is we were sort of lacking context on what kinds of precautions schools were taking. So if we said, okay, some schools have a lot of cases, some schools don't have a lot of cases, like we need to know, what are they doing differently? Is it just random chance? Or, is it that masking is really important? Is it the distancing? What about ventilation? So we sort of have a sense of these things being important, but there wasn't a systematic data collection effort. So, I got together with sort of 2 different groups to try to fill this gap. So the first is a bunch of educational organizations, most notably the Association of School Superintendents, but also the National Principals Associations, and then a large number of independent school associations. So sort of trying to get a core of people in the education space who would have access to schools and districts. And then at the same time, a kind of data team. So they came out of Qualtrics, and they have donated a ton of time. Qualtrics is a technology enterprise company that does surveys and analysis, and they kind of helped us build out the data collection effort here, and they've been hugely valuable in running what has turned out to be a larger project than we may have anticipated. So what are we doing? So the project is actually very simple in conception. The idea is to start with schools and go to schools, individual schools or to districts, and ask them a bunch of baseline questions. We try to make it simple, but comprehensive enough that we can use the data. So we ask them about enrollment, we ask them about staff levels, we ask them what their in-person or remote opening situation is, and in particular, how many kids they have, how many sort of kids and staff they have in the building. So, there's a lot of schools that are sort of full-time in person. Even there, in most cases, they're not operating at 100%, right? So they almost all places have given families a choice. So you'll have a sort of, I'm open full-time in person, but I'm really only seeing 80% of my kids, or I'm open hybrid on a typical day, I've got 50% of the kids. So we've kind of got that number to get a sense of like, what should we think about as a number of kids in school? And then at the same time, we ask them about these mitigation factors. We ask maybe 10 or 11 factors: masking, distancing, ventilation, and so on. So we do that. We collect that data by school, and also some basic stuff like, are you an elementary school or a middle school? Regular things that people know. And then we come back to them every 2 weeks, and we ask them how many COVID cases they have. We ask them to confirm their reopen plan and how many COVID cases did you have, and then we put the data in a dashboard. So that is the basic idea. And when I sort of thought about it like that in advance, I was like, oh, this is so simple, it'll be really easy to do. That turned out it's a little more complicated than I had anticipated and than any of us had anticipated, but I think we've made some progress. And so We now have sort of 2 waves of data kind of covering September. We're in the process of collecting a 3rd wave, which should be up early next week. But let me show you what we've got so far, because like I think the big pitch here is really that we are trying to make this accessible to people, so people can actually like look at the data themselves and think about what they learned from it. So this is our landing page website, covidschooldashboard.com. From here, you can do various things like hint, enroll your school or district, but you can also view the dashboard. Nat, can you see the full dashboard now? Yeah, okay. So then you see this dashboard, and we have sort of, we've been sort of focused on like these numbers. So this is the sort of confirmed infection rate in students. So this is the number of infections reported in a given 2-week period. This is our most recent 2-week period, divided by the number of in-person, sort of average in-person students in that period. So this says this number is 0.15%. So that says, in this sample of places, and we can talk a little bit about what that means. In this sample of places, in a school of 1,000, you'd have about 1.5 cases over a 2-week period. So there's different ways to sort of think about COVID numbers. That translates to something like a daily rate of 10 per 100,000. So that's kind of in the range of numbers we're talking about. In the staff, that number would be about 2.7 cases in a staff of 1,000 over a 2-week period. So that's what we're seeing. Sorry, somebody is. Okay. So that's what we're seeing. We can. I apologize. Nat, is there something, I can't see the chat because I'm terrible at Zoom, as now everyone on this webinar knows. Is there something in the chat I need to pay attention to? Okay, so what I sort of, and then you can also see in the dashboard, like some things about our population. So there's about 700,000 total enrolled kids in the data we're covering, and about 220,000 of them are in person. Are sort of like in person on a typical day, and then we can do some things up here with our filters. So what I sort of like about this is it actually lets you dig a little bit into the things you might like to see in the data. So for example, we can ask the question, well, is this different across age groups? So I think we all have kind of a sense that maybe there's differences across age groups. So I can say, well, what if I exclude the schools that have high schools? And what you see is this number is now smaller. On the converse, if I say, well, let me basically only take the high schools, then it's bigger, right? So we're sort of seeing differences across age groups in the way that we might expect. We're seeing differences across school types. So private schools are, have cases about half the rate of district public schools. And then you can like filter by state. As we get more data, this will get better. And finally, let me sort of show you one more picture, and then I will kind of sum up what I think we learned. We can actually see the mitigation strategies that places are taking here, and I think that this is particularly useful to understand some things about the sample and just some things about what's going on here. So almost everybody in this sample has masking policies. And some kind of distancing and sort of symptom checking. But then when you get into sort of this middle range, we're kind of more like 50-50. So thinking about things like, are you having class outside? Do you have kind of very like limitations on group sizes or fixed cohorts? Those are not happening as consistently. And we see almost no testing, So what do we kind of take away from this? I think, one thing is just we need more data, and we are really focused on collecting more data and getting more stuff, and things, all kinds of great stuff. Like as an academic, I'm looking forward to doing because I like data. So looking at things like, how correlated are this sort of rates with masking and distancing and so on. And, how much are we seeing large outbreaks versus small numbers of things? But so far, I would say, the data is looking, fairly reassuring. The rates are fairly low. They're sort of scaling with community spread, but at a lower level. And, to some extent, they look like they look like people are kind of bringing COVID from outside, as opposed to that there's a lot of like spread in the schools. And I'll just say one fact, which is sort of consistent with that, is that when we look at teachers who are in remote learning environments, so there's no kids in school, those rates are basically, actually, if anything, a bit higher than the students than the teachers and students who are in school. So we're sort of seeing some things there that kind of make it look like it may be the sort of the community that is kind of driving this, as opposed to the schools. But it's early days, and we're still working on this. And I'm hoping that this data set will be useful as we go into the fall and we really try to understand cold and flu season and evaluate how we can reopen safely. So let me stop there.
All right, well, thanks, Emily. And I will just echo your comment earlier that you made, sort of demurely, if you work in a school or a district, you should participate. This is valuable data that Emily's gathering. I'm going to ask Ian and our other panelists to come back onto the screen. And while they're coming on, I'll just remind everybody that we will have live Q&A come later. And if you could just submit your questions on Twitter with the hashtag #InPersonLearningK12, that's hashtag #InPersonLearningK12, we can funnel those questions to Ian. So Ian, all yours.
All right, so Nat and Emily, thank you very much. That was extremely informative, and Emily, somewhat encouraging to see that infection rates seem to be pretty low. We are now joined by Sarah Cohodes, who's an associate professor of economics and education at Teachers College at Columbia University. Also Marla Ucelli-Kashyap, who's a senior director for educational issues at the American Federation of Teachers. And then finally, Susan Enfield, who's the superintendent, someone who's actually in charge of making these decisions at Highline Public Schools in Washington State. And Sarah, I'd like to start with you because Nat and Emily have given us, quite a great picture. But are there other factors at play here? I mean, I did a panel just yesterday with 3 parents, all of whom were sending their kids to schools that had provided an in-person option, but in all 3 cases, they chose not to send their children to school. They either were homeschooling or chose the remote option. So what's additional context that our viewers should think about as you look at and respond to Nat and Emily?
So thank you for having me here, and thanks to Nat and Emily for sharing their new data. I just want to highlight how insane it is that it is Emily and Nat who are collecting this data, and we don't have government entities who are giving us guidelines and centralized data mechanisms that would be collecting these sorts of information, and thank them for doing that effort. The biggest thing that I want to add to the conversation is the fiscal cliff that schools are facing. So I'm not just talking about special money to fund reopening in a pandemic. Schools need money for PPE, digital infrastructure, ventilation. But on top of all that, we have a pandemic-induced recession, which means that states have much lower revenues and that they have less funding for schools. So some school districts have already begun laying off teachers, and the districts that are going to be the most affected are those that rely the most on state funding, which tend to be school districts that don't have a large local property tax base. So laying off teachers right now, to me, seems absolutely off the wall. There's no model of school reopening that would not benefit from having lots of teachers, lots of staff, and that includes remote teaching. So where are we? We have a crisis for children and families who need school, and remote teaching, as we saw from Nat's evidence, is not up to the task and maybe not even reaching all students. We have good but not perfect evidence from Emily and elsewhere that schools are not what is driving the pandemic. There's a small but real risk of COVID-19 in schools and teachers who are wary of returning in person. And sometimes that's because they're seeing little mitigation, little efforts, and have experienced real losses and fears. And we see Black and Latinx people who have been hit hardest by the pandemic. And when given the option, many are not sending their children back to school in person, even when it's available. And we're on the precipice of laying off teachers when we need them the most. So the two crucial challenges I see right now, on top of the lack of government action in so many areas, are communication and trust. How do we get people to trust Emily's evidence and similar evidence that we're seeing from around the globe and places in the United States that have reopened without seeing spikes and outbreaks? And how can we handle all of these logistics challenges in the face of this lack of funding, lack of support? How can we reopen and mitigate appropriately? So my final thought is that we held Europe up this summer as an example of virus suppression, but now cases are surging again there, just as they're surging now in the US. Maybe Europe will get a better handle on this wave than us, and maybe they won't, we don't know yet. But the biggest difference I'm seeing when I'm looking at these two areas is a difference in attitudes towards schooling. In Europe, schools are the last things to close, and the appropriate efforts are being put to close other things like bars, which people who know me know that I have a bugaboo about that. We know what to do, and we have more information than we did in March when we had universal closures and universal lockdowns. We can be more selective. So my call to everybody here is, what can we do, not just within schools, but across all of the country, to put schools first and to help children and families?
Sarah, thank you for that. I mean, Marla, Sarah laid out a number of the issues beyond the health concerns, the fiscal issues, the lack of government accountability in terms of tracking this data, but she really focused on this idea of communication and trust. So from the perspective of teachers and teachers unions, how do you get teachers to feel comfortable to go back into these environments, especially given all of the uncertainty and complexities around health?
Yeah, thanks, Ian. It's great to be here and really appreciated Emily and Nat's presentation. And Sarah, I've never met you before, but I feel like we've been reading each other's emails. But just to kind of start on the sobering note where we are today, right now, infection rates are increasing in 38 states in our country as we're sitting here talking about this. And one thing we know from the perspective, of AFT, we all know there are no easy or perfect decisions. I mean, I do not envy the kind of work that Susan is doing right now. Really, there are two big reasons that teachers want to go back to school. The first is they know learning is better in person for a vast majority of their students, and particularly the most vulnerable educationally and economically. The second reason they want to go back is that a lot of them feel like they're either working one very big job if they're teaching remotely, or working two jobs if they're teaching hybrid. And so we've been saying pretty much since April, based on the science, safe reopening requires some things. What are those things? Public health safeguards to prevent the spread of COVID in schools, including masks and physical distancing, and cleaning and ventilation and hand washing and sanitizing protocols, right? Nothing shocking there. We also believe reasonable accommodations for school staff who are at greater risk because of personal or household health vulnerabilities are important. There needs to be a low infection rate in the community, or at least evidence of some kind of containment of the virus. Is it your declining rate of cases for 14 days or something that makes sense? We didn't specify what. And there really needs to be the infrastructure to test, trace, and isolate cases of COVID or suspected COVID. Equally important as a plan for opening schools effectively, you need to have a plan for reclosing and reopening on a class, a school, or a neighborhood by neighborhood basis if things go south in terms of transmission. And finally, and Sarah, you were right on this, you need the necessary resources to provide those safeguards, as well as the supports to meet the social, emotional, and academic needs of students. So our polling, and that of many others, there is way too much polling out there right now, says that those ideas are not super controversial, but they happen to be pretty darn hard. And so kind of why is that? especially if we know that if done right, what we see is schools aren't super spreaders if all those things are in place, right? So, one of the challenges is that we know communities of color are disproportionately impacted by COVID, both health-wise and economically. So in our cities, we are seeing that parents who have the hybrid remote choice are choosing remote. In New York City, it started 46%. 2 weeks in, it's up to 52% choosing remote. The irony of that for me is that in-person working in some places, and there are a few examples of that, right? There are real examples in places that are actually cities, small or large, particularly small. It's not happening much in large cities yet, with limited exception, is that those choices that parents are making to keep their kids remote are enabling the opening of schools with smaller numbers of kids and allowing the distancing, right? So it's not exactly a zero-sum game, but it's a really tough game. I don't need to say further that we don't have the best data. Thank you, Emily, Nat, NEA, some of our affiliates who are trying to do this kind of collection. We also don't have a public health infrastructure that really allows us to do what needs to be done, whether it's testing or isolating or tracing. But I think that one thing that's really important for us to know, and Sarah, you got at this as well, is that actual safety and perception of safety both really matter. And that's where things like the impact of structural racism in access to healthcare, the history of labor management relations in a community, those things come into play, right? So we talked about, I think it was Nat who mentioned that, we're learning new things every day, and what new information are we learning? I just saw a new report from the National Academy of Sciences that just came out a couple days ago. And they really, I think, brought home this notion that you can't separate in-person learning from resources. In developing plans for reopening, I'm quoting the report, and implementing mitigation strategies, districts need to take into account existing disparities within and across schools, whether it's facilities, staffing shortages, or overcrowding, or even the ability to provide masks. Districts that are highly resourced, have well-maintained buildings, they'll be more likely to implement those strategies, and then more kids can go to school. So our approach has been, just think about from the perspective of a teacher or a parent, would you send your child to or work in a school that is not highly resourced and can't put those strategies into place? So what we and our affiliates borne out around the country, and what we're hearing from our members, is what we want to do is figure this out together, but we don't want to do it without resources. We don't want to do it without a role along with school district and public health authorities in figuring out the how, and we want a lot of open communication along the way.
Well, Marla, thank you. Thank you for laying out even more complexities. I mean, you just said infection rates are going up, I think you said in 38 states. And yet Emily's data shows that the infection rates are like 0.15%. I mean, Susan, you run a district with 19,000 students. How are you balancing all of this information to make what can seem like life or death decisions, not only for your staff, but also for kids?
Yeah, thanks, Ian. And Sarah and Marla, thank you for that context. I really appreciate it. It's a nice backdrop for what I'm going to share about the work here. And I can say that Highline was an early contributor to Emily's work. So we are a participant because I do think it's critically important. So Highline is a richly diverse school system, and we have a promise to know every student by name, strength, and need, so they graduate prepared for the future they choose. I would argue a promise that is more important today than ever before. I think I can safely speak for every superintendent I know when I say we're asking the wrong question. Of course we should send kids back to school in person. The question is, can we? And how do we do it smartly? And that is the question that superintendents like myself are having to wrestle with right now. And the challenge is that the information that we are getting from public health officials, from our state education agencies, changes so rapidly that what I tell my school community today is true, tomorrow may be different. And so I preface everything by saying, what we know today is this, and we make decisions that way. I will also say that the challenge for district leaders is that we each have very unique contexts, and it's important that we make these decisions based on the local context in which we're living. And what I mean by that is we're located just south of Seattle. We're only about 30 minutes away from the facility where the first fatality from COVID occurred in the United States back in the spring. So that contextual piece matters. There's, I think, a heightened sense of awareness and concern around the virus that exists in the Puget Sound area where we are. My goal this entire time has been to make sure that, number one, we're keeping our students fed, safe, connected, and educated. Number two, that we're providing our staff with the supports they need to do so, and that we're connecting with and supporting our families as best we can as well. I've also worked incredibly hard to try to provide consistent information in a world of inconsistent and conflicting information that people are trying to wrestle with. And one of the things that we promised our community early on was that we would take our guidance from King County Public Health and the State Department of Health. We would follow their guidelines for when it was safe to reopen. And so the metric, and I know that Washington State has been the subject of some question as to whether we are more conservative in our metrics for reopening. That's not my decision. As a public school superintendent, I have the responsibility to work within the metrics and the frameworks that my public health officials are giving me. And the reality is that while rates are starting to go up as they are elsewhere, when you look at King County overall, I have parents saying, well, it doesn't look that bad. But where I am in South King County, the rates are significantly higher. And this is where it gets tricky. You can't just look at a county rate. You need to look at district-specific city rates. And the reality is that we know this virus impacts communities of color at higher rates than others. And so if you are blessed to serve in a richly diverse district like Highline, as I am, we see our COVID activity rates in our district 2 to 3 times higher than what the county average is. I am desperate to get children back in school, but I cannot in good conscience say to my staff and teachers and families and kids, come back in person when our rates are that high. I just can't do that. It does not mean that I don't want to. I desperately want to, but we have made a commitment that we will keep the health and safety of our students, staff, and families paramount. And frankly, our families have told us, and I think someone alluded to this earlier, that many will likely choose to keep their students at home even when we do transition into hybrid. I think the other thing that is worth considering, I mean, obviously we're driven by what the COVID activity rates are. That's first and foremost. But the hybrid model is incredibly complex. And I think my colleagues who are moving forward with their hybrid models would say incredibly challenging. I think Marla alluded to the fact that it's incredibly tough on teachers. It's a big lift for them. And so I also had to weigh, does my staff have the capacity to pull that off? I cannot in any way overstate the level of exhaustion and burnout and sadness and frustration of those of us working in public education today. And I have the responsibility to make decisions in the best interest, yes, of my children, but not at the expense of my staff. I have to weigh all of those things. And if we are going to return in a hybrid, which we will at some point, we have to be able to get it right. My board and I made the incredibly painful decision last Friday that we would remain in distance learning through the end of the first semester. It's a horrible decision. I don't want to be in distance learning. But the reality is the emotional angst and energy that staff and families were expending, worrying about what's going to happen, what are we going to do? Are very clear, the winter surge is coming. And so were we to come back in hybrid, I would likely be shutting down again. And my concern is that that level of uncertainty and chaos would just wreak havoc on families and staff. And so we made the difficult decision, which I believe is the right one for Highline. But the challenge is that I know kids are losing. I know they are. I know this model is hard on my staff, and heaven knows I know it's hard on families. But as I said in one of my early interviews, when this pandemic started, we are simply being asked to do the impossible as school district superintendents. There are no good answers here. And so we are just trying to make thoughtful, compassionate decisions based on the data that we have that is in the best interest of our specific communities.
Susan, thank you. From the perspective of a real practitioner, balancing the needs of trying to do hybrid well, I totally get it. There's actually a network of charter schools in New York City, Success Academy, that proactively said we're 100% remote through the end of this calendar year at least. And so Nat, and please them to Q&A. But Nat, we just got a question, and given the reality, even though we all do want and believe that in-person instruction is much more optimal for kids, the reality is that remote learning is going to be with us for some time. Have you seen enough improvements in remote learning across the country where it's not as much of a sacrifice to kids learning as what we saw earlier this spring? You're on mute. Hey, Nat, you're on mute.
Thank you. That's an excellent question, Ian, and it's one that's at top of mind. So I would first just caution that based on the improvements that we've seen in our data, that those aren't good measures of the quality of instruction. It's really just sort of baseline measures. So it's certainly better than if we were running off of paper packets this fall. We're glad we're clearing that bar. But I think that a lot of the struggles that we had with students sort of ghosting remote instruction are just going to continue to be a struggle. It's a part, not really a feature, but it's a part of remote instruction. It's going to be part of the struggle. It's just easier to connect with kids when they're there in person and to keep them interested. So there's a lot of reasons for that. I would say that, and every person that I've talked to, be they teacher or administrator, says that this is harder than in-person learning. The research that we've had over time as far as how well remote learning works is not good, and that's with self-selected groups, not with everybody forced into this. So I don't think there's anybody that's really saying, it's probably going to be okay. I think everybody's saying, no, it's not going to be okay. There's obviously very real concerns about just turning a blind eye to the risks of coming back or trying to jump into, from the frying pan into the fire with a hybrid plan that you're not ready for. But that does not mean that remote learning long-term isn't going to be a major drag on students' academic outcomes and their life outcomes.
Yeah. Emily, do you want to weigh in on that as well? Oh, you're on mute as well.
Yeah, I mean, I think, there were a thing that I think is really resonant with all of us and comes out of all of this is just that like remote learning is very hard, but that the back and forth is in some ways like the hardest thing, and it's hard for everybody. And so I think part of what has been really challenging about this fall is, there are some places that kind of went for it and opened in person with sort of, I think with some success, some of them. And then there's the sort of remote option. I think the thing that has been transitioning between those has proved to be a really difficult, is proving to be, I think, really difficult. And, I was struck by what you said about success, because I actually talked to Diva Moskowitz about this decision at some point early on. And she said, look, we really needed to invest in learning, and we could not simultaneously spend all this time like trying to optimize our remote and also figure out, should we have people here for 45 minutes and, Tuesday afternoons, and then how are we going to manage that? And that like, there was sort of a need to like invest in the remote. And that was going to make it as good as possible. And so I think there's kind of that tension. We're really seeing that come out, that just doing both things is really, really hard. It's a huge lift for teachers and for superintendents and for like everyone.
Yeah. I mean, Emily, your data is so compelling, and granted, we need more of it, but is it opportunity to declare victory that whether it is because of access to PPE or social distancing that the infection rates are so low, should we have confidence, or should we not be trying to send the message to leaders like Susan to say, or Marla, that the rates are low and we should be more aggressively putting kids back in person?
I think there's sort of two things I would say out of our data. So one is that it's pretty clear that the school rates are going to reflect the community rates. And so if and we're seeing that, it's not that they're higher, right? So some people I think worry like we're going to come into the schools and there's going to be like huge outbreaks that are driven by K-12 schools. We're not seeing that. We don't see it in our data, but I don't think we're seeing it in other data either. Not that there aren't any, but that like this is not a feature of the sort of K-12 environment, particularly the elementary kids. But that is very different from saying we won't have cases of COVID in schools. And it is going to scale with the community. If your community testing, prevalence rate is 5%, that means like basically about 5% of your people are going to have COVID. And even if they don't spread it at all at school, you're going to have trouble keeping your school open when 5% of your teachers are out with COVID, plus the people you have to quarantine. So I think there's a sort of caution there that would that is real. And is something we need to kind of think about how that's manageable. The other thing I would say is our data are from schools that are doing the things that Marla has highlighted as important to do. They are masking, a lot of them are distancing. I think we will learn more about which of those things are the most important as we kind of move forward, and that's going to be like really key because the capacity for schools to do these different things is different. I will say, I think more districts should be open than are. I think that there are a lot of districts, particularly around where I live, it seems very unfair that like East Providence has opened their schools for kids and the kids are at school. And, like one step across the border in Seekonk, everyone is learning remotely. I think that suggests that there's probably not a good consistent set of decision-making going on in some of these places, particularly in the Northeast with very low prevalence.
Yeah.
I'll just
Can I?
I'll
Sorry,
just jump in very quickly, just to echo that in Emily's data, you see differential rates between high schools and elementary schools. And this question may be bad in some sense to say, well, should they just be schools? I mean, there's a difference between elementary schools and high schools, both in the potential for infections and community spread, but also in the importance of in-person learning for second graders compared to, a junior in high school. It's just going to be easier. And I think that it's important to draw that out. If we were to prioritize something, I would be 100% for getting young kids in first because, school isn't about lectures to them. It's not about information transmission. It's about, learning how to socialize and relate to teachers. So I'll be brief, but.
Yep. Marla, you wanted to weigh in as well?
Yeah, I wanted to jump in both on that priority and kind of on, building on what we've learned. We have learned a lot from everything from like childcare provided to the kids of frontline workers early on. Like we know we can do things. Young kids can wear masks, right? We know what Nat just said about it being more important for young kids and also more doable to be in person. We also know that places that started out doing things like remote learning as part of the way they do business, districts that have done that have a head start. We know that with planning time, you can make both remote and hybrid better. Hybrid is incredibly difficult to do, but actual real collaborative planning time in Massachusetts, they kept the year the same for teachers, shortened it for kids so that time would exist. So there are things we can do all along the way, but I also want us to remember that sometimes it's easiest to get the data, and I think Emily is seeing this, in places that are more resourced to begin with. And so we got to be careful that what we're learning is applicable to places that don't have those resources and don't have low community spread and don't have low density, et cetera.
Yeah. So Sarah, you talked about communication and trust being so critical, and Marla laid out almost a checklist of the things that need to be in place. Emily has laid out, has identified those schools that seem to be doing the things that dramatically decrease infection rates. How do parents know? How would you handle this question of communication and trust? Because it seems like there is a lot of knowledge out there, and do parents have access to the information so that they could actually hold districts accountable for doing the things that are driving the infection rates so low based on Emily's data?
So I think that um, it's a huge challenge, and if I knew the answer, I would have written the article that says, you know, this is the key. I think there's a lot of power potentially in this idea around starting with the youngest children, where we're starting to see this body of evidence more and more compelling. I've been talking about this since July, that younger children are less at risk, have the most need, and also mitigation efforts are easier in elementary schools where you don't have periods throughout the day, teachers and students switching around. So perhaps that is one path forward. But I also think that there really is something to say for leadership at every single level, from the very top to state leadership to district leadership, to be very clear, as we heard Susan saying, these are the criteria, these are the standards that we're adhering to, and that's what we are going to follow, so that there is less of this uncertainty. I think there also is a job to say, to communicate and talk about how it is going to be a bumpy road, and that identifying positive cases is not a bad thing. It should be viewed as a good thing in the context of low transmission overall. Identifying cases and closing classrooms, for example, is an opportunity to stop the spread. And while it's going to be frustrating and it is going to be hard on individual families and people who need to work and quarantine and balance all of those needs, to get us to act together around that, as opposed to thinking of that as something scary or something to fear.
Thank you. Emily, we just got a very practical question from Gemma for you. And basically she says, because we know a significant share of families are still choosing remote, even though their districts may be offering in-person instruction, how does that impact how we view your data? Because is it predictive? If we get more kids now going in person, can we assume that the infection rates would be the same?
Right. I mean, I think this is a good question. I think, you know, you can filter our data by places that are full-time in person versus hybrid, and that's going to give you a sense of the density. This is something we know a little bit more about on the back end. And so actually, like in principle could do more analysis of. But it is, you know, is certainly, I think Marla highlighted this, you know, some districts are benefiting from the fact that like they're able to distance a bit more with having fewer people in person. But I will say we're not seeing huge, at least, you know, in the last time I looked into the data, we don't see like, you know, sort of huge differences in rates across places that are hybrid versus full-time. And similarly, as I said, with the teachers, even for places that are sort of like fully remote, again, kind of consistent with this idea that what's happening is people are kind of acquiring much of the infectious community required and is arriving in. So I think the big question I'd ask there is, you know, how important are some of these things like distancing, which will be more difficult if you have 50% of your students than 25 or 75 versus 50. Yeah. I think we'll know more about that soon.
Ian, I wanted to just say one quick thing about, in sort of response to that, but also what Sarah said, and just point out the one thing that I'm mad about. I'm not mad that more schools aren't open, even though I do think more schools should be open, but I am mad about, I'm just angry about the fact that we have a major failure as far as data collection. Emily and her effort should not be one of the principal ways that we find out how transmission in school is affecting these things. We should have, you know, Congress should authorize the Department of Education to gather data on this, to get the denominator so that we can know whether we can send students back or not. That's how you make people confident, by having a scientific method that gives people confidence. And it's an abject failure that I'm having, no offense, Emily, on this webinar instead of, you know, a CDC operation or some equivalent.
I totally agree. I mean, I love being on your webinar, Nat, but like, I wish that there was somebody else on this webinar than me.
So where is the voice of superintendents like Susan? Like Susan, are you part of consortiums who are asking that question? Why is it that there isn't a central source of data? Because I would imagine that you and many of your colleagues are looking towards your leadership to say, give us more guidance here.
Yeah, I will say, I think that there's been just an unforgivable lack of leadership at the federal and the state level. The real leadership that we've seen during this time is coming at the district level, because we've been left to figure this out on our own. And I agree, I'm grateful for the work that Emily's doing, but we should be having that from somewhere else. And that therein lies the challenge, that we are each left to figure this out on our own. And that is what makes the trust factor so difficult. I am fortunate in that I'm a bit of an anomaly in that I'm serving in my 9th year as superintendent at Highline. I know my community knows me. And even the people that don't like me, they know who I am and they know what I stand for, right? And there is a level of trust that I have with my staff and my community because of my longevity. But most superintendents are lucky if they've been in their district for 3 years. And so I think that compounds this trust factor. So you have this notion that, we're not getting good, reliable data at the state or federal level. And if you're new to your community, you haven't been able to build up that trust yet. And I think that that really is critical. I will say though, because there is so much to be angry about and frustrated about and some days hopeless about, but there is good happening. And I think it's really important to acknowledge that our kids and our teachers and staff and families, so many of them are figuring it out. And each week I get to sit in on Zoom classrooms, and from kindergarten to high school. And there are amazing things happening. And while yes, I lose sleep over what our students are losing now and what the long-term impact on our children will be from having been out of school, because even though my staff is doing a great job, doing the best they can at distance learning, the reality is that my children in Highline will, when this is said and done, have been out of school buildings for at least a year, if not longer. And that is real. And that concerns me greatly. And I don't think at the same time we should sell our kids short. Children are resilient. They do amazing things. And so I am torn between acknowledging the negative long-term impacts that I think will be very real, and balancing that with the fact that our kids are figuring it out and there is learning going on, and they are doing really great things. And I don't want to rob them of the resilience, the confidence that they have by talking too much about the fact that this is really doing harm, because there is good going on. And it's so important that we focus on that too, and celebrate our kids and our staff and our families who are doing that.
Wow, thank you, Susan. Well, we're almost at time. I do want to give each person just 1 minute to close this out. And maybe I'll just ask the question, what do we need to have in place, let's say by January 1, for us to see great increases in the number of kids that are in school in person? And then what's the likelihood that those things will be in place by then? And if each of you could give me a minute. Nat, do you want to kick that off?
Yeah, I do. I will. So I'm not quite confident on this because sort of, blood on the page sells newspapers. But, coverage of schools where we're not having these problems, and of the, it's going better in some places than we think. And there's a stilted coverage, I think, because, when problems arise, we can sell a lot of stories and generate a lot of clicks. And if we could have more balanced coverage of what's going on out there, I think we can actually move the needle on not just, school leaders, but where the rubber meets the road is on parents' confidence in reopening schools. I'm hopeful.
Yep. Marla?
Great question. I think the thing that we need, two things we need most. One is an easy winter. Because frankly, a big barrier to school reopening, especially in our cities and with a lot of old physical plants, is the ventilation systems are not up to it. And when the heat is on, it's going to be a problem. So I'm hoping for an easy winter. The other thing I think we really need, there's no doubt about it, is we need action on a HEROES Act for stimulus from the Senate. an updated version of what the House passed in May. And we need that to be able to close some of the chasm that has emerged and widened between our most resourced and least resourced schools, and frankly, to keep our states and cities afloat.
Okay, Sarah?
I think we need a new administration.
Okay. Emily?
Yeah, so I mean, I think we need a way to be tracking better what is going on in our schools, and I think we need better control of community spread. I mean, I think that this is the key, particularly for schools, is going to be like, it's going to reflect the community. And if we allow everything else to be open, it's going to be hard to keep schools open also. I think we need to be prioritizing this as an important thing. And if that means, bars have to be at 20% capacity rather than 100% capacity, I think that is the kind of sacrifice, or zero, even better, that is the kind of sacrifice I think we need to be sort of starting to talk about.
Yep. And Susan, given that you mentioned you made the heartbreaking decision to keep school remote only through the first trimester, what has to be in place by January 1st to reverse that decision?
Well, I think to get us to January 1st, sadly, we're going to have a lonely holiday season. I think we're going to have to make some hard choices during a time when we're used to coming together and doing lots of things, and that will require a lot of self-discipline. More importantly, though, we need an administration that picks up the work that Emily has started and provides districts with consistent guidance on how and when to reopen. And leaving it district by district, which is what we have right now. Districts are making these decisions independently, and it's chaos. And it puts superintendents in impossible positions, and it does not inspire confidence, nor should it, in staff and families. And so an administration that will pick up this work and provide very consistent guidance on how we go about getting our kids back in school.
Well, everyone, thank you. That was very powerful, very informative, and hopefully our leadership is listening, and we all want to do what's best for kids, and that's to get them back in school safely, and teachers. So thank you, everyone, for listening. This was a great session, and onward.
Thank you. Thank you all.
Thank you all.
Thank you.
Thank you.